Congratulations on your new baby. My name is Mary Jo Beeman and I'm the childbirth educator at Women's. We want to facilitate your transition home with some important information. You should have a mother-baby book in your room, which is a wealth of information for new parents about their newborn and the changes in mom's body after delivery. The inside cover of the book explains the steps to access a website which includes over 20 videos that range from baby's hunger cues, tips for breastfeeding, car seat safety, and how to cope with a crying baby. I'd like to review some highlights with you before discharge. As far as safety, please bring your car seat into the hospital before you're discharged. If necessary, the nurse can help you adjust the straps to fit your newborn. If your baby is less than 37 weeks or meets other criteria, you may be asked to bring the car seat in the day before for a car seat test. During the first weeks after delivery, when developing a routine with a new baby, put your purse or phone in the back seat along with your baby as an added reminder that you have a baby on board when you're traveling. You should never leave a child alone in a car, even if you plan to come back soon, because temperatures in cars can get dangerously hot very quickly. Babies are born with heads that are large in proportion to their bodies and very weak neck muscles. Therefore, it's important to support the baby's head when holding them for the first few weeks or months. Some babies develop very fussy times, usually in late afternoon or early evening when they cry constantly. This can be very frustrating for parents. If parents get agitated, they may be tempted to shake a baby while holding them. Even the slightest shaking, which causes a baby's head to bob back and forward, can cause internal bleeding resulting in brain damage, blindness, and even death. This is known as shaken baby syndrome. Crying is a baby's primary means of communicating a need, being hungry, tired, overstimulated, or sick. The mother-baby booklet lists some ways to comfort a crying baby. First, is he showing hunger cues? Check for wet and dirty diapers. Check the baby's clothes to see if they're wet, tight, or uncomfortable. Does he seem to be in pain, too warm, or too cold? A pediatrician came up with the 5 S's to remember comfort techniques when a baby's basic needs have been addressed. These techniques include swaddling, sucking, side-lying, shushing, and swinging or rocking. To those, I add skin to skin. If parents need a break from a colicky, fussy baby, find another person you trust to keep your baby for a while. If alone, put your baby in a safe place, such as their crib or bassinet, on their back, turn off the lights, shut the door, and go to another room until you're calm. Sometimes that may be all your baby needs to stop crying, especially if he's overstimulated or tired. Remember the safe sleep recommendations of the AAP to reduce the risk of SIDS in your baby's first year of life. Always put your baby on their back to sleep, on a firm, flat surface with no loose blankets, stuffed animals, bumper pads, or other things that might be a suffocation risk. Breastfeeding reduces the risk of SIDS by more than 50%. Pacifiers are a good SIDS reducer, but wait 3 to 4 weeks until breastfeeding is well established before introducing it. Don't overdress or overheat your baby. Your baby only needs one light layer beyond what you're wearing. Don't let anyone smoke around your baby. Even clothes that smell like smoke should be changed before holding your baby to reduce their risk of SIDS. Well baby visits are very important. Vaccines prevent certain childhood diseases, and the pediatrician will follow your baby for growth and development. Safe sleep environment is also an important part as your baby grows and learns to sit or stand. There are products on the market labeled as sleepers or rockers that are in a semi-sitting or hammock-style position. These are not safe sleep spaces for infants, as mentioned previously, due to their heavy heads and weak neck muscles. Head drop and chin tuck can pinch an infant's small airway, making it difficult to get adequate oxygen. Only use these when you're observing your infant and they're awake. If they fall asleep in a sitting or semi-sitting position, move them to a flat, safe sleep space. positioning on their backs so they can maintain their airway easily. Siblings that are under school age should not have unsupervised access to your newborn. They're not strong enough, nor do they have the judgment to handle infants. Teach older children how to hold your baby safely by supporting their head, following the SIDS recommendations, and remembering never to shake a baby. Your baby should never sleep with a sibling, but encourage siblings to spend time with the baby and teach them to play safely with the baby. Sibling rivalry is normal, but teaching older children how to interact with their new sibling will encourage a positive relationship between them. Also, be sure to provide one-on-one time with your older child so they don't feel neglected, since you'll be spending a lot of time with your newborn. If older children are present in your household, toys with small parts may be present and pose a choking risk to your infant. Teach older children to pick up their toys and not to leave them where the baby could grab and put them in her mouth. Toys that are safe for newborns include mobiles that are high above the crib, out of the baby's reach, soft toys and stuffed animals, non-breakable baby-safe mirrors, and soft books with colors and textures. Your nurse has asked you to record the baby's wet and dirty diapers as well as their feedings while you're in the hospital. Continue recording for the first month when you get home. You may choose to record on paper or download an app on your phone, but take the information with you when you go to your pediatrician visits. By the 6th day of life, your baby should have at least 6 to 8 wet diapers each day and 3 to 6 dirties. They should also have a minimum of 8 good feedings every 24 hours that include nighttime feedings. If your baby sleeps more than 4 hours at a time, try to awaken him for a feeding so that he gets enough calories to maintain proper growth. Signs that your baby is getting enough milk include sufficient wet and dirty diapers. They seem calm and content after feedings and regain their birth weight within 10 to 14 days. Watch your baby's feeding cues to know when to feed. Opening their mouth, sucking, making hand-to-mouth movements, rooting, fidgeting, and crying is a late feeding cue. On the day of discharge, your nurse will remove the plastic cord clamp. The cord stump will not fall off for 7 to 10 days. Keep the diaper below the cord to keep it dry and clean. If urine or stool gets on the stump, just wipe it with wipes and warm water and dry. When the stump falls off, there may be a small amount of bleeding. Observe the belly button for any signs of infection, redness, heat, tenderness, or pus. Sponge bathe your baby every 2 to 3 days for the first 2 weeks to allow time for the cord stump or the circumcision, if you've had that done, to completely heal before immersing in a bath. When bathing your baby or changing diapers, observe the baby's skin. If any redness or irritation is noted, use a diaper cream to protect and promote healing. If not better in 48 hours, consult your healthcare provider. For long fingernails, use the emery board to file their nails, preferably while sleeping. The back of the Mother-Baby book has 2 pages listing the warning signs for your baby when you should call the pediatrician and the warning signs for mom to call her obstetrician. Warning signs to call your pediatrician include a temperature of greater than 99.5 Fahrenheit under the armpit, breathing difficulty or coughing frequently. If they have blue lips or serious difficulty breathing, call 911. Feeding problems, including less than 8 feedings in 24 hours, poor feeding, choking, sleeping longer than 4 hours at a time, or not regaining their birth weight by 2 weeks. Extremely fussy or limp and listless babies. If your baby's hard to awaken, has projectile vomiting, or the skins or whites of their eyes look yellow. The umbilical cord stump or the circumcision show any signs of infection, such as redness, tenderness, foul odor, or pus. If they have insufficient wet or dirty diapers, or a drastic change in bowel patterns after the first week, pebbly stools or watery stools. If your baby has tremors or seizures, that needs immediate attention. Call 911. Women's Hospital also offers instruction in infant CPR. If you do not know how to perform infant CPR, tell your nurse and we'll be happy to provide instruction for you. On the day of discharge, the pediatrician will write discharge orders for your baby and the obstetrician will write discharge orders for mom. Your nurse will prepare all the information and appointments and bring the paperwork for you to review and sign. She'll give you an appointment time to return with your baby, usually 1 or 2 days after discharge, to the newborn follow-up here at Women's Hospital. Upon arrival, you'll be given a sticker identification tag and the admissions clerk will direct you to the newborn follow-up. The follow-up nurse will weigh your baby, do a jaundice check, and any other follow-up tests that are necessary. If you have any feeding issues or breastfeeding questions, the lactation consultant can come and talk with you and observe a feeding. At the end of this checkup, the nurse will remind you to make a 2-week appointment with the pediatrician to begin your well baby visits. Now let's talk for a minute about the postpartum care for mom. Immediately after the placenta is delivered, the uterus begins to shrink back to its pre-pregnant size, but this takes about 6 weeks. The first week or so, you may feel some cramping and you'll have some bright red bleeding called lochia. This is a vaginal discharge caused by the shedding of blood and tissue from your uterus. It may be heavy the first week, but should decrease in amount and change from red to brown to white. It can continue for about 6 weeks, although some women have a discharge for only about a week or 2. As long as you have discharge, continue to rinse with the peri bottles after you use the restroom, and remember to always wipe from front to back to avoid a urinary tract infection. If you become too active at home, the bleeding may increase. If you have enough bright red bleeding to soak a maternity pad in an hour, pass clots larger than a ping pong ball, or the lochia has a foul odor, lie down and call your doctor. Practice pelvic rest, which means avoid inserting anything into the vaginal canal that could track bacteria into your uterus and cause an infection until your cervix has fully closed. In other words, no tampons, douching, or sexual intercourse until your 6 weeks checkup with your healthcare provider. Since you won't be getting 8 hours uninterrupted sleep for a while, rest when your baby is sleeping to try to get 8 hours cumulatively every day. Eat a well-balanced diet rich in fruits, vegetables, grains, protein, and dairy. Drink plenty of fluids, and most healthcare providers encourage mothers to continue to take their prenatal vitamins. Hopefully, adequate fluids and fiber will prevent constipation. However, milk of magnesia or stool softeners can ease discomfort. If you have stitches in your perineum, they will absorb in several weeks. You can do sitz baths 3 to 4 times a day for 20 minutes to ease discomfort and promote healing. Ask your nurse if you would like a sitz bath. Between day 2 and 5 after delivery, your milk will come in and your breasts will become engorged. After this initial engorgement, the maintenance of milk supply is based more on demand. The more the baby nurses or the mom pumps, the more milk your body will make. Therefore, breastfeeding mothers should watch for baby's feeding cues and feed often in the first few weeks. Avoid pacifiers for the first 3 to 4 weeks until milk supply is well established. Nursing your baby is also a great source of comfort as well as nutrition. Fever, flu-like aches, and red tender breast are symptoms of a breast infection called mastitis. Call your healthcare provider if you have any of these symptoms. A good latch is very important in preventing sore, cracked, or bleeding nipples. If your baby's latch is painful, break suction and remove the baby from the breast, letting them relatch. Make sure that your baby gets a deep latch so it doesn't pinch the nipple, causing pain and nipple damage. If you note an area of the breast that is lumpy after your baby finishes on that breast, it could be a clogged milk duct. Prior to the next feeding, Put a warm compress on the area for at least 10 minutes before the baby latches and gently massage toward the nipple to try and open the duct. If you had a cesarean delivery, look at your incision in the mirror daily and notify your healthcare provider if you note bleeding, drainage, separation of the edges, redness, swelling, or tenderness. Avoid lifting anything heavier than your baby, around 10 pounds. Improve your circulation and reduce stress by gentle stretches and walking, but talk to your healthcare provider before beginning an exercise regimen. If you get dizzy, short of breath, or have an increase in bleeding or pain with activity, stop and notify your healthcare provider. You may notice baby blues in the first couple of weeks after delivery, and that's due to hormonal fluctuations. This is normal and should resolve in a couple of weeks. But if you notice feelings of overwhelming sadness or anxiety that interfere with your daily activities, you may be developing a perinatal mood or anxiety disorder caused by hormonal imbalances. Take the postpartum depression self-test in the Mother-Baby book. If you're scored 10 or greater, notify your healthcare provider so they can get some help for you. We want your birth experience to be a happy time. If you have any of these warning signs, notify your healthcare provider immediately. Swelling of your face or hands, a severe headache or blurred vision, nausea or vomiting, abdominal pain, especially under the ribs on the right side, very little urine output, sudden weight gain of greater than 2 pounds in a week, chest pain or pain in one extremity, which could be a blood clot. Or if you have thoughts of harming yourself or your baby, that is an emergency. Call 911. If you have any questions about any of this information, please ask your nurse or call 4956. Thank you for choosing North Mississippi Women's Hospital so that we could celebrate this birth experience with you.